All right, if you're a nursing student getting ready for the NCLEX, you know there are some topics you just have to know inside and out. And today, we're going to tackle one of the absolute biggest, electrolyte imbalances. So let's jump right in. So let me ask you something. You've got seizures, cardiac arrest, and muscle weakness. Three super serious and, seemingly unrelated emergencies. What's the one thing that could possibly connect all of them? It sounds like a trick question. But for you as a nurse, this is going to be a daily reality. And there it is. That's our answer, an electrolyte imbalance. It is the hidden culprit behind so many clinical problems, and that is exactly why the NCLEX is obsessed with testing you on it. So let's make absolutely sure you are ready for those questions.
So what even are electrolytes? Well, I want you to think of them as the body's electrical wiring. Seriously, they're these tiny charged particles that are zipping around, powering everything from a thought firing in your brain to the squeeze of your heart. Without them, well, the lights just go out.
Okay, first up, we've got sodium and its best friend, chloride. Whenever you think sodium, I need you to immediately think of two things, fluid balance and the brain. It's the master regulator of where water goes in the body, and your brain is super sensitive to that.
And here we go. Your first must-know, non-negotiable number to memorize, 135 to 145. That is the normal, happy range for sodium. The second it goes above or below that, you're heading into dangerous territory, especially for the brain.
This table really lays out the danger zone for us. Now, when sodium is too high, we call that hypernatremia. The body is basically all dried out. Think extreme thirst, really dry mouth. But when sodium is too low, hyponatremia, that's when things get scary for the brain. Fluid actually starts to shift into the brain cells, causing them to swell. This leads to confusion, and here's your huge NCLEX red flag, seizures. So what do we do? Well, your nursing actions have to match the risk. If you see low sodium, hyponatremia on an NCLEX question, your first thought, your priority is safety. You need to get those seizure precautions in place. And a little pro tip for you, chloride almost always follows sodium. They're like partners in crime. If one is low, the other probably is too. All right, next up is the undisputed king of electrolytes when it comes to the heart, potassium. If sodium runs the brain, you better believe potassium runs the heart. So I really need you to pay close attention here, because this is a massive topic on the NCLEX. Just look at how tight that range is, 3.5 to 5.0. It is so narrow. And there's a good reason for that. Even a tiny little shift can throw the heart's entire electrical system into absolute chaos. This is another number you have got to know by heart. No pun intended. Now, when potassium gets too high, that's hyperkalemia, it follows this really dangerous path. It often just starts with some general muscle weakness. But the real life-threatening danger is what it does to the heart muscle. It can lead to deadly arrhythmias. And the number one cause is usually renal failure, because if the kidneys aren't working, they can't get rid of that extra potassium. This next point is so important, it needs its own slide. I want this burned into your brain. For the NCLEX, if you see high potassium, your first thought, your immediate thought, has to be the heart. That means your priority action is always going to be cardiac monitoring. No exceptions. Okay, so how in the world do you remember all the signs of high potassium? Well, this mnemonic might sound a little grim, but trust me, it is an amazing tool. It's murder. M is for muscle weakness. U for changes in urine output. R for respiratory failure. D for decreased cardiac contractility. Think a weak pulse or low blood pressure. E for those early muscle twitches. And the big one, R, for rhythm changes on the EKG. And this chart right here shows you the danger perfectly. See how as the potassium level climbs up into that hyperkalemic range, that T wave on the EKG just shoots up? Those tall, pointy, peaked T waves are the classic textbook sign of dangerously high potassium. Seeing that on a monitor is a true medical emergency. All right, let's shift gears a little bit. We're moving from the heart to the muscles and nerves. And our next pair, calcium and magnesium, they act as the body's great stabilizers. Their job is to keep the neuromuscular system calm, cool, and collected. And here it is, your next critical range to commit to memory. For calcium, it's 8.5 to 10.5. Just like all the others, you've just got to know this range. It's fundamental. Calcium is actually pretty easy to understand because it has this really clear opposite relationship with excitability. I want you to think of it like a dimmer switch for your nerves. Too little calcium, hypocalcemia, and that switch is cranked all the way up. Everything is overexcited. You get spasms, twitching, even convulsions. But too much calcium, hypercalcemia, and that dimmer switch is turned way, way down. Everything gets sluggish, weak, and reflexes can even disappear. Now, for low calcium, the NCLEX loves, and I mean loves, to test two specific signs, Trousseau's and Chvostek signs. These are classic indicators of that neuromuscular hyperexcitability, and I can almost guarantee you'll see them on your exam. The mnemonic cramps is a fantastic way to remember all those signs of being overexcited. Okay, here's a massive NCLEX study hack for you. Ready? Magnesium is calcium's twin. They act almost exactly the same. So low magnesium causes the same hyperexcitability, those muscle spasms and twitching, as low calcium. If you know one, you basically know the other. They often drop together, so always think of them as a pair.
Okay. Wow, we have covered the key players. So now let's lock in the absolute must-know life-saving priorities for your exam. If you forget everything else from this explainer, I need you to remember these next 3 slides. This is the stuff that keeps your patient safe.
First up, high potassium is the cardiac killer. Your immediate #1 priority action is to get that patient on a cardiac monitor. You're the one who has to be watching for those deadly peaked T waves that tell you cardiac arrest could be right around the corner. Second, low sodium is the neuro threat. Your first priority here is always safety. You have to protect that patient's head and airway by starting seizure precautions. After that, you're doing frequent neurochecks, watching for any little change in their level of consciousness. And third, low calcium is the airway risk. Why? Because that same neuromuscular excitability that causes hand spasms can also cause the muscles of the larynx to spasm, a laryngospasm, and that can completely block off their airway. So your priority is to monitor their breathing and be ready to protect that airway at all costs. So there you have it. You've got the tools now. You know the priorities. So I want you to take a second and think like a nurse. After everything we've just covered, which one of these imbalances really makes your own heart beat a little bit faster? Which one would worry the most if you saw it on your patient's chart? I really hope this review helps you feel way more confident for the NCLEX. If you found it helpful, do me a favor and hit that like and subscribe button so you don't miss our next explainer. We're going to build right on this knowledge and connect it all to IV fluids and acid-base balance. Thanks for studying with me today.